Uceris, budesonide, extended-release tablets are a glucocorticosteroid indicated for the induction of remission in patients with active mild to moderate ulcerative colitis. Uceris extended-release tablets are contraindicated in patients with hypersensitivity to budesonide or any of the ingredients of Uceris tablets. Anaphylactic reactions have occurred with other budesonide formulations. Uceris 9 mg tablets are a next-generation oral steroid designed with MMX delayed and extended-release technology, one tablet once a day. Uceris combines a gastro-resistant outer coating with a multi-matrix core that is designed to enable budesonide to reach the entire colon. The tablet's coating allows the tablet to pass through most of the gastrointestinal tract intact. Upon reaching a pH of 7 or higher in the terminal ileum, the tablet begins to dissolve. Intestinal fluids interact with the lipophilic matrix, slowing the entrance of water into the tablet. When the water merges with the hydrophilic matrix, a viscous hydrogel is created, which gradually disperses budesonide throughout the colon for comprehensive coverage. Uceris delivers topically acting budesonide to the site of UC and is designed to minimize systemic exposure with up to 90% first-pass metabolism and has potency 15 times that of prednisolone. Unlike other oral budesonide formulations, Uceris tablets are proven by scintigraphic data to act at the mucosal lining throughout the colon, targeting UC right at the source. For site-specific action where you need it, and minimal systemic effects where you don't. Uceris tablets, next generation colon-specific UC relief. Important safety information: Uceris extended-release tablets. Uceris extended-release tablets are contraindicated in patients with hypersensitivity to budesonide or any of the ingredients of Uceris tablets. Anaphylactic reactions have occurred with other budesonide formulations. When glucocorticosteroids are used chronically, systemic effects such as hypercorticism and adrenal suppression may occur. Since Uceris tablets are a glucocorticosteroid, general warnings concerning glucocorticoids should be followed. Care is needed in patients who are transferred from glucocorticosteroid treatment with higher systemic effects to glucocorticosteroids with lower systemic effects, such as Uceris tablets, since symptoms attributed to withdrawal of steroid therapy, including those of acute adrenal suppression or benign intracranial hypertension, may develop. Adrenocortical function monitoring may be required in these patients. Taper patients slowly from systemic corticosteroids if transferring to Uceris tablets. Patients who are on drugs that suppress the immune system are more susceptible to infection than healthy individuals. Glucocorticosteroids should be used with caution, if at all, in patients with active or quiescent tuberculosis infection, untreated fungal, bacterial, systemic viral or parasitic infections, or ocular herpes simplex. More serious or even fatal courses of chickenpox or measles can occur in susceptible patients. Caution should be taken in patients with hypertension, diabetes mellitus, osteoporosis, peptic ulcer, glaucoma or cataracts, or with a family history of diabetes or glaucoma, or with any other condition where glucocorticosteroids may have unwanted effects. In clinical studies, the most common adverse reactions of Uceris tablets occurring in greater than or equal to 2% of Uceris patients and at a higher incidence than placebo were headache 11%, nausea 5%, decreased blood cortisol 4%, upper abdominal pain 4%, fatigue 3%, flatulence 2%, abdominal distension 2%, acne 2%, urinary tract infection 2%, arthralgia 2%, and constipation 2%. Concomitant use of inhibitors of cytochrome P450-3A4, such as ketoconazole, itraconazole, ritonavir, indinavir, sequinavir, erythromycin, should be avoided, and patients should be closely monitored for increased signs and/or symptoms of hypercorticism. Advise patients to avoid ingestion of grapefruit and grapefruit juice, which is known to inhibit CYP3A4 when taking Uceris tablets. Since the dissolution of the coating of Uceris tablets is pH-dependent, the release properties and uptake of the compound may be altered when Uceris tablets are used after treatment with gastric acid-reducing agents, e.g. PPIs, H2 blockers, and antacids. There are no adequate and well-controlled studies in pregnant women. Budesonide should be used during pregnancy only if the potential benefit justifies the potential risk to the fetus. Budesonide is secreted in human milk. A decision should be made whether to discontinue nursing or to discontinue Uceris tablets, taking into account the clinical importance of Uceris tablets to the mother. Patients with moderate to severe liver disease should be monitored for increased signs and/or symptoms of hypercorticism. Discontinuing the use of Uceris tablets should be considered in these patients. To report suspected adverse reactions, contact Salix Pharmaceuticals at 1-800-321-4576 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.